We are answering your questions about the coronavirus and children with Cone Health's Pediatric Services Executive Medical Director, Dr. Michael Cinoman. This question is, if a child previously had COVID, should they wait 90 days to get the vaccine?
In general, that is what we recommend, yes. The real important part of that question is a lot of people think if they've had COVID before, they do not need to be vaccinated. And that is not true. There are people who get COVID who can catch it again or different variant, but the vaccine actually seems to provide better immunity or prevention from getting COVID again than having the infection itself. So after that 90-day period, yes, we recommend everyone go get vaccinated.
All right, this person is asking, should vaccinated people continue to wear their mask when they're around children under the age of 12?
Again, as the CDC just came out with guidelines, updated guidelines, that fully vaccinated people for themselves are at much diminished risk. So they recommended under most circumstances being outside and in many indoor settings as well that masks are no longer necessary. However, most children under 12 are not going to be vaccinated. So if you're in a group setting or around children who are under 12 who have not been vaccinated, even though that you have, I think probably the better part of valor and what we would recommend is that, yes, you still wear a mask.
Okay, this person is asking, if it's true that kids under 12 are really not likely to catch the virus, why would you want to give them the vaccine?
That is a great question. And as I alluded to earlier, the chances of a child under 12 or in the pediatric population getting very sick with COVID are less than they are with adults. However, this is the world that I work in. I'm a pediatric intensivist by practice. And unfortunately, there are plenty of children who still end up in the hospital, who end up with heart failure, who end up on, some children have ended up on heart-lung machine, and a rare set, but some who have died from COVID-19. So although the chances of getting very sick are less, it still can be very serious, and it is completely, essentially preventable. So with a very simple, safe way to do it. So nobody wants this. Even if you're under 12, you want to be able to prevent it.
I think people would be surprised to hear that you have seen children COVID patients that die here.
We have. Again, not nearly as common in the adult world, but we, when they present to the hospital, we've had children hospitalized with pneumonia, just like adults who get very sick and have difficulty breathing, and others who develop an inflammatory process called MISC that people may have heard about that can cause heart failure and make people's blood pressure very low, and they can require very significant treatment and be very sick for a long period of time.
I think you just always think it's happening somewhere else. So this person is saying, should someone with allergies under the age of 16 take the vaccine?
Yes. Again, the only contraindication that I mentioned before were allergies to a very rare component of the vaccine, that's polyethylene glycol. But most children with food allergies or allergies to medicines, absolutely, those would not be contraindication. However, if somebody has specific questions, we of course would recommend that they talk to their doctor.
Okay, very quickly, because we have underneath a minute. If a child, 12 years old, wants to be vaccinated, do they have to have their parent with them?
I think you asked you meant the 12 to 15 age range. We encourage it. We generally feel like it's best when parents are there. However, the law of North Carolina does not require it, and specifically states that if we're approached, that they have the author, we are to vaccinate them. So we will, but we much prefer the parents to be with their children when possible.
Sure, absolutely. Thank you so much, Dr. Cinoman, for joining us today, lending your time and your expertise. Thank you for joining us and asking your questions. You can find all of this in the Who Wants to Know section.